I'm Dr. Mark. We're coming to you again from Two Rivers Treads in Ranson, West Virginia, your foot therapy headquarters. So today we're going to talk about some of the common conditions we see in the foot as related to the toes and the metatarsal heads. So a common thing we see is what's called a hammer toe condition, where the extensor muscles on the front of the leg start pulling the toes this way, and the flexor muscles start to overstretch. And this can cause conditions of pain along the metatarsal heads because the fat pad, which usually protects these metatarsal heads, has been migrated this way. Some of those conditions can be called metatarsalgia, neuromas. Maybe you've had these conditions yourself. So first thing is to identify that this is your problem. If you look at a foot straight on this way, the toes look kind of straight, but when you look from the side, you'll see that this first joint is up in the air. These muscles here are really pointing on this first joint. So you can do some manual things to correct this condition. One would be called the toe extensor stretch. So I'm bringing these toes down, and this causes some tension in here. And you can foam roll the tibialis anterior area, or the shin area you might call it, and just gradually kind of work these toes down, and never do it to the point of pain. This is going to take weeks of manual therapy to try to bring these toes down. Another device you can put in your shoe is a metatarsal pad. As you notice, if I put some tension here right behind the metatarsal heads, you'll see the toes start to come down and the fat pad will start to reapproximate where it should go. So one device that you can use for this is called a metatarsal pad, and this is a pad with a little bit of a bump that you can stick in your insole right here, so when you walk it's going to push your toes back down. And we want our toes on the ground because our toes actually have some function as a spring. When our toes are up here, the metatarsal heads take all the beating. The Barefoot Science insole also has a little bump and can also function like that. So the Barefoot Science insole, which progressively adds more bump over the weeks, can do the same thing. But again, combining something in your footwear with some manual therapy can help get your little toes on the ground so your footprint looks like it did when you were a baby and they had that beautiful footprint with all of your toes on the ground. We have a plantar pressure mat, and you can see that this customer toes do not even touch the ground. And so if you come in and we're looking at you, we can put you on one of these plates to kind of quantify what's going on, and then you can come back, a few months later, you can see what's going on. So again, have a problem with your metatarsals, foot pain, toes are up in the air, come talk to us, we can help you correct it.